My upper body movement is the lateral raise. This is a staple and a very simple upper body movement that I use in all of my workouts. The lateral raise will work the front deltoid, supraspinatus, and trapezius. It also requires focus on the core and spine to remain stable while performing the movement. This is a great exercise for the shoulder muscle and joints. The primary muscle is the front or anterior deltoid. During the lateral raise, the supraspinatus initiates abduction and the trapezius muscle helps with the scapula lift. The wrist and finger flexors will also be working during this movement to grip the dumbbells. The client will begin with reasonable weight dumbbells in each hand, arms at their sides, slightly in front of their thighs, and palms facing the body. Head is neutral, eyes are forward, and spine and core are activated so the body doesn't move during the entire movement. Keeping a slight bend in the elbows, the client will slowly abduct, raise arms out to the side. The arms and dumbbells will raise until they create a T-like position and are straight out from the shoulder, not raising arms above the shoulder joint. The arms will still be slightly in front of the body and always maintaining a slight bend in the elbow joint. After reaching the top of the movement, the client will slowly lower the dumbbells back to their side to the starting position. For this movement, the client needs to focus solely on the shoulder muscle and joint and make sure they are not moving their core or the spine. The core and the spine must remain activated and tight during this movement. This helps prevent spine injury by moving back and forth or performing the movement wrong by swaying back and forth. Also, the individual needs to always keep a slight bend in the elbows and make sure their arms are not completely extended. If the arms are too extended, this will put too much strain on the elbow joint and not enough focus on the shoulder joint. This could also lead to elbow injury if this movement is performed incorrectly. Another important point to make with this movement is that you will need to be able to control the momentum. You need to be able to control both the concentric, the upward movement, and the eccentric, the downward movement. The concentric movement needs to be just as controlled so that you do not have too much momentum and the dumbbells are not swinging down and you could cause a lot of shoulder injury if you're not really focusing on that shoulder stability for this movement. Also important is spine and core stability and your posture. You must maintain a straight spine, an activated core, and make sure your body is stabilized to prevent swaying, because swaying will take away from the whole movement that you're just trying to focus on your shoulders, not on moving any other part of your body except your arms working that shoulder joint. To help the client or to help you know what muscle should be working, I would palpate the anterior deltoid and the side deltoid to show you which muscle should be activated and which one you're going to want to be doing the mind to muscle. For a lot of women, our shoulders can be very weak and hard to perform the mind to muscle. So I want you to really make sure that you're feeling it in those deltoids and really focusing on that shoulder movement to help improve that shoulder stability and shoulder strength. That will really help with a lot of everyday movements. I would also explain how to hold your body in this position is also working your core and your stability at the same time while working your shoulder muscles. It's not a compound movement, but it's a great way to learn how to really activate that core and spine. Another thing I would really want to focus on is your tempo. This tempo needs to be very slow, very controlled. We're not trying to race through this. This is going to be a lower rep count so that we can go very slow and really focus on that shoulder while staying very stable in your upper body. We don't want anything else moving. We want all the focus on those shoulders. So we're going to keep this movement nice and slow and focused. For my ab movement, I chose the marching toe taps exercise. As opposed to a regular sit-up or crunch, this exercise requires more focus and a lot of activation in that core. This requires the client to focus solely on their core and the movements. I want this client to really know how to properly engage and really properly activate her core, as well as improve on the movements in her posture and her spine. The marching toe taps is also great for postpartum women because it helps heal and strengthen the pelvic core muscles that are weakened during pregnancy and during child delivery. A lot of other core exercises use different parts of the body and can sometimes allow people to not completely engage their core. But this exercise, you really are just really focusing on that core and on that core activation. Also, this is something that can be done anywhere. It can be done outside of the gym, at home. No equipment is required. So that's why I really think it's a great staple piece for clients to learn for a good ab and core activation exercise. The primary muscle groups being trained are the transverse abdominis, the pelvic floor muscles, the multifidus, and the diaphragm. All of these muscles work together to perform this movement. I would begin with my client on a yoga mat, lying on their back with legs bent at a 90-degree angle, feet up, palms pressed into the ground. I would instruct my client to press their spine into the floor and activate those core muscles. I would make sure their spine is completely pressed by pressing my fingers under the spine. I would tell my client that this is the feeling they should have and hold on to throughout the entire movement. Their spine must stay pressed into the ground and core activated to perform the movement correctly. For the toe taps, the client will begin with the right leg, keeping the knee bent at 90 degrees and slowly lower their foot down so their toe touches or taps the ground. This movement should be done slowly and carefully so that the core always stay activated. The client's spine must stay pressed to the ground and core must stay activated. If either of these doesn't happen, if the core becomes unactivated, the client can limit the range of motion in the hips or extend their leg a little bit so it's past 90 degrees, and it can make it a little bit easier for them to stay activated because the focus is on the core activation. And as you can see here, you can continue, go back and forth. You go right, left, right, one leg at a time, very slowly, very controlled. You can see here in my example that I have my knees not at 90 degrees, but a little past, and I'm not touching my toe all the way because I'm really trying to focus on keeping my spine pressed into the ground and making sure my core stays activated. So this just shows too that this exercise has many different levels and can be different options for people depending on their fitness level. Two ways that this exercise can really be performed incorrectly. One is when someone is doing the movement too quickly. You want to make sure that this movement is also very slow and very controlled. If there's too much momentum, it'll completely defeat the purpose of activating that core. This is really just to focus on core and learn core activation. So you want to make sure the momentum is very slow. Also, you do not want to be using your hip flexors in this movement. This is a core movement, so really focus on that core. You use your hip flexors to keep your hips at the 90-degree angle at the top, but still try to make sure you're really feeling it in your core and not just using your hip flexors to pull the muscle, to pull your leg up and down. For the lower body exercise, I'm going to explain a hip thrust. This is a more advanced movement for clients that can lift a little more heavy and are ready for more weightlifting. This is actually one of my favorite movements, but this is a really good for that hip range of motion and really activating the hamstrings and focus on the glutes. This is really for someone that wants stronger glutes and stronger hamstrings, and it's a great compound movement that works both of those while really focusing on the glutes. It also is a great exercise to increase hip mobility. I like this movement for more advanced clients because it allows more focus on the glutes with less stress on the back and lower joints and lower joint muscles than a deadlift or squat movement. The hip thrust also requires more core and spine stabilization, making it more advanced movement. This is exactly what it sounds like. You're thrusting your hips, flexing and extending the hip joints with a weighted barbell on your hips. This movement requires a normal range of motion in the hip joint and a strong core. A great thing about hip thrust is that you can make small changes to increase or decrease difficulty. For example, bodyweight hip thrusts can be very beneficial to start out with, and then increasing resistance after the client or you have mastered the movement. You can also change foot placement, placing one foot in front of the other to focus on one leg at a time for more isolation movement. The muscles being trained or used during this exercise are the hamstrings, the gluteus maximus, the lower back, and the core. For this movement, the client will begin seated on the ground with legs extended anterior to the body and a bench behind them. The bar will be right over their hips. The client will then bridge up, maintaining the barbell on their hips, and put the shoulders on the edge of the bench. Feet are hip width apart, placed flat on the ground, and there's a straight line from the knee to the ankle with the legs bent. Starting from this movement with the hips flexed, the hip thrust is done by contracting the gluteus maximus and the hamstrings to extend the hips while keeping a slight posterior pelvic tilt. After extending the hips, the client will slowly lower the trunk area and flex the hips, not letting the hips or the glutes touch the ground. This will be 1 rep, and then the client will hip thrust and extend the hip joint again for the 2nd rep. The client needs to keep their head and eyes forward, chin towards the chest, but not touching the chest. This movement, the client wants to make sure they're keeping their core and spine tight and straight. The movement is really focused on the hip joint, the gluteus maximus, and the hamstrings. So the client should never arch or extend their back or feel it in their back or their neck. The client always wants to maintain a straight spine from neck to lumbar region. One way people perform this exercise incorrectly is by arching their back, extending their neck, and using the spinal extensors to thrust the hips and barbells instead of stabilizing their core and using the hamstrings and gluteus maximus to perform the hip thrust. This can lead to some spinal injuries, so you want to make sure you're really having that pelvic tilt posteriorly, really keeping the core tight and really focusing on those glutes. Another way is by limiting the range of motion. You want to make sure you're staying comfortable with that range of motion, but that you're getting a good hip joint range of motion during this movement. I would really focus on watching to make sure they're activating their hip extension and hip flexion, making sure their feet were not moving, they're staying perpendicular to their knees and to the ground, and really focus on that core and that spine and make sure it's tight so that you're really feeling it in this hamstring and your glutes. I would also want a controlled tempo and speed. It doesn't have to be slow, but you want it definitely to be a control speed so that they're controlling the momentum on both the hip thrust and then the hip flexion.